So what references or tools do we have in relation to talking about handwriting disorders? Both the ICD-11 and the DSM-5 from 2018 onwards refer to disorder in written expression or impairment in written expression under the specific learning difficulty coding rather than mentioning a dysgraphia. This group is proposing to use the term disorder in written expression in brackets motor dysgraphia. Dysgraphia can cause trouble with forming letters and writing, but it also causes issues with visual spatial processing, expressive language, grammar, and organising thoughts to tell a story in coherence. It can present as a motoric, spatial, or cognitive linguistic issue when writing. In essence, it is difficulty with writing by hand. This is why we feel we need to stipulate motor dysgraphia in brackets, so that we are referring to the fact that disorder in written expression can also be due to cognitive linguistic difficulties, but this will be outside the remit of occupational therapists. The DSM looks at the severity of the condition, referring to mild, moderate, or severe difficulties with written expression, while the ICD does not. On this slide here, you can read the specific descriptions that the DSM and the ICD use to discuss difficulties with written expression. Other synonyms for handwriting problems that you may see in the literature or used by other professionals are dysgraphia, specific learning disorder with impairment in written expression, developmental expressive writing disorder, developmental agraphia, developmental spelling disorder, written expression disorder, disorder of written expression, or disturbance in spelling. As mentioned earlier, not enough is known in relation to differentiating these different terms. There is different subtypes proposed, with the first three on this list being quoted by the SESS on their website and the NCSE. Dyslexic dysgraphia is where a person's spontaneous written work is illegible, copied work is reasonable, and spelling is bad. For these students, their finger tapping speed is normal. A person with dyslexic dysgraphia does not necessarily have dyslexia. However, dyslexia and dysgraphia appear to be unrelated but can often co-occur together. Thinking back to Dr. Berninger's model earlier, she would say that dysgraphia, Tier 1, is difficulties with orthographic processing, whereas dyslexia, Tier 2, is difficulties with phonology. Once again, having difficulties at Tier 2 can mean you also have a difficulty at Tier 1, but if you only have a difficulty at Tier 1, you do not have difficulties in Tier 2 or Tier 3. Motor dysgraphia is thought to be due to deficient fine motor skills, poor dexterity, poor muscle tone, and/or unspecified motor clumsiness. Generally, written work is poor to illegible, even if copied by sight from another document. Letter formation may be acceptable in very short samples of writing, but this requires extreme effort, an unreasonable amount of time to accomplish, and cannot be sustained for a significant length of time. Writing is often slanted due to holding a pen or pencil incorrectly. Spelling skills, however, are not impaired. Finger tapping speed results are below normal. This profile may be due to the presence of developmental coordination disorder, and wider motor testing should be considered to outrule a differential diagnosis. Spatial dysgraphia is due to a defect in the understanding of space. This person has illegible spontaneous written work, illegible copied work, but normal spelling and normal finger tapping speed. Students with spatial dysgraphia often have trouble keeping their writing on the lines and difficulty with spacing between words. There are two other subtypes of dysgraphia mentioned in the literature. The first is phonological dysgraphia, which is characterized by writing and spelling disturbances in which the spelling of unfamiliar words, non-words, and phonetically irregular words is impaired. Individuals with phonological dysgraphia are also unable to hold phonemes in memory and blend them in their appropriate sequence to produce the target word. This could be considered a specific learning difficulty in the area of spelling. Lexical dysgraphia then is evidenced when a person can spell but relies on standard sound-to-letter patterns with misspelling of irregular words. This is more common in languages such as English and French, which are less phonetic than a language such as Spanish. This type of dysgraphia is very rare in children, but could implicate orthographic processing loop difficulties. Research would suggest that most students with dysgraphia have a mixed form of the disorder. For clarity, it is recommended by this group that 2 subtypes be used to talk about handwriting difficulties. This idea is also reflected in the literature. The 2 subtypes are motor dysgraphia, which is non-language based, and linguistic dysgraphia, which is language based. This dysgraphia incorporates cognitive linguistic challenges. The literature suggests that a mixed presentation can and is commonly seen. Motor-based dysgraphia can be viewed as difficulties with the mechanical aspects of writing. Often students with this type of dysgraphia are able to structure and sequence their ideas effectively, but struggle with the manual aspects of handwriting. This results in writing becoming a tiring, laborious, and sometimes painful process for the student. Language-based dysgraphia, on the other hand, is more consistent with delays in processing and sequencing ideas in writing. The content of the writing is well below the level expected, despite the students being able to present their ideas clearly and concisely orally. The linguistic component of handwriting matches words to their graphemic, that is picture, representation, whereas the non-linguistic motor component translates orthographic, i.e. the picture representation, into writing via motor skills. So as you can imagine from the information we've covered on the previous slides, there is multiple professionals necessary in order to examine all aspects of the handwriting process. An OT would evaluate motor-based issues, for example, difficulties with legibility, speed, fatigue, poor posture, poor pencil group, difficulty with organising of ideas, visual perceptual difficulties, motor difficulties, and sensory difficulties. An evaluation by a psychologist would more give an overview of the overall cognitive IQ of the child, difficulties with spelling, punctuation, and grammar, in addition to memory issues and difficulties with executive functions. They are also able to identify if the child is experiencing a specific learning difficulties in other areas, for example, reading, spelling, or math. Evaluation by a speech and language therapist is necessary to examine the specific language issues. For example, if their written expression content is below expectation, if they've poor sequencing of ideas, if they've difficulties with ideation or word finding, and to identify potential blocks to written expression and explore whether the presence of a language disorder is also there. Research would suggest that children presenting with speech and language issues in preschool is a strong red flag for a pure form of dysgraphia or oral written language impairment. In an ideal world, evaluation would consist of at least two professionals to be able to identify potential comorbid disorders, for example, dyslexia, developmental language disorder, developmental coordination disorder, hypermobility, etc. However, this may not always be necessary, accessible, or feasible. If motor dysgraphia is evident, we propose that this diagnosis is made and the child is referred onwards for further investigation to see if cognitive linguistic issues are also affecting their difficulties with handwriting. It is proposed by this group that the formal diagnosis of a disorder of written expression, also known as dysgraphia, should not take place in children before the age of 9. However, the best time to screen for dysgraphia or identify children at risk of dysgraphia is of crucial importance for intervention purposes. Early identification of handwriting difficulties can commence in preschool during pre-writing and be supported through early intervention and developmental monitoring. After 9 years of age, children may need to be reviewed in preparation for post-primary, additional supports, technology use, and to ensure inclusive access to the curriculum through thorough assessment. A diagnosis of the disorder of written expression, motor dysgraphia, can prove effective to this end. In summary, children experiencing handwriting difficulties should undergo specific interventions before the age of 9. After the age of 9, if interventions have already tried to improve their handwriting difficulties, accommodations and recommendations should be made. As with all learning disorders, differentiating situations in which children have difficulty writing considerations need to also be given to any medical, developmental, physical or sensory impairments, deficient educational opportunities, environmental deprivation or cultural differences which may be contributing to the poor achievement in written expression. For children, their success within the education system becomes increasingly reliant on their ability to produce legible and fluid written work. Students who are struggling in the area of handwriting and written expression require early identification, guidance, and accommodations to support them in meeting their academic potential. In most cases, handwriting problems do not go away on their own. Once difficulties with spelling and handwriting, particularly around speed and legibility, have been assessed, it is important to consider aspects of writing related to composition. This is a complex area underpinned by oral language skills, pragmatic language skills, and working memory. From the recent research we conducted, in the order of importance, the following assessments were named as useful assessments for OTs to use in identifying handwriting difficulties. The DASH, the VMI, the Irish adaptation of the handwriting speed test, the movement ABC, the Brunnings, the SPM, McMaster's protocol, and the Heatherly sentence completion test, to name a few. A study in 2011 found that none of the standardised tests of handwriting readiness included all the necessary components to evaluate writing readiness. Therefore, the development of an all-encompassing assessment is necessary to test handwriting readiness and to make tailored interventions possible. This is possibly why this assessment list is so long and so diverse. Handwriting is a major occupation in childhood that's essential for children's participation in the classroom. The BERI should be used as part of a writing readiness assessment. The fine motor score of the Brunnings is more stable than the movement ABC, as it has 8 items rather than 3. In terms of psychometrics, the Brunnings and the BERI are most satisfactory. In kindergarten or early primary school, handwriting and spelling make statistically significant contributions to written expression, demonstrating the importance of these lower order transcription skills to higher order text generation from a very early age. The contribution of oral language and reading skills were not as significant. Scores of spelling tests don't show why a child is having a problem. For example, are there errors with spelling phonological, orthographic, or morphological in nature? Which professional should be responsible for remedying the child's spelling difficulties would be decided by identifying the pattern of errors they are making in spelling tasks. Due to our skills with task analysis, an OT would be very useful in identifying the types of errors a child is making in spelling and making onward recommendations in relation to intervention programs and/or professionals necessary to intervene with that specific type of spelling difficulty. Other possible OT interventions and solutions for handwriting difficulties are handwriting without tears, loops and other groups, visualizing and verbalizing, seeing stars, moving to typing, using dictation, and strengthening manual dexterity, core, and upper limb. The child may also need a language program from a speech and language therapist and/or mind mapping, story sentence structure, etc. from SLT and/or psychology in order to remediate all aspects of their underlying difficulties in all parts of the handwriting process. That is, the OT interventions would address the motor difficulties, while the SLT and/or psychology interventions would address the cognitive linguistic difficulties.